One of the common questions people ask me as an occupational therapist is that if I find people work for a living. Initially, I would probably answer no, but there's some truth to the matter. Everyone has a job, a role, or an occupation. For example, I am a son, a brother, a therapist, a student, an educator, and many more. If some illness or dysfunction happens to a person, their engagement in that role or occupation will be affected. That's when an occupational therapist or an OT steps in. They assist people in regaining functions in their occupation as workers, family members, and members of society. They assist a lot of people in returning home. More importantly, they assist people in engaging in life. Occupational therapy is a therapeutic use of activities to increase a person's participation in a functional role or occupation, whether it's in school, at home, at work, leisure, a group, or in society. In occupational therapy, one extremely important occupational role is a person's participation in activities of daily living or self-care tasks, examples of which are grooming, toilet hygiene, dressing, bathing, self-feeding, and functional mobility. Another important occupation that OTs evaluate is the participation of a client in instrumental activities of daily living. These are activities that assist a person to function and live in the community, like cleaning house, balancing checks, cooking, shopping, communication, and computer use. Work, play, and leisure are all occupations that people engage in. When illness and dysfunction hits, these areas are affected. OTs look at people's engagement in these areas. OTs are able to present a holistic approach to treating illness or dysfunction. When evaluating a client's decreased role in an occupation, an OT looks at various components that can affect his or her performance. They look at physical, social, emotional, mental, and cultural components that affect a client. And yes, going to school is an occupation of many children. OTs are important in assisting many students in adapting and gaining skills that are educationally important. Examples of skills are fine motor tasks, socialization, attention, and many more. And for many of the older people, a skilled nursing facility is their home. An OT's role there will be to increase the older person's quality of life, help them engage in activities of daily living, increasing functional mobility, and decreasing the risk of falls there. OTs can also assist people who have been injured physically to go back to work. In work hardening, OTs treat patients to increase the patient's productivity to go back to work. They can assist people in restoring strength or teaching them compensatory techniques for work. Sensory integration is an OT setting in which we look at how our nervous system receives input from our senses and how individuals respond and interact with the environment. OTs are concerned with all the senses: sight, hearing, taste, smell, touch, proprioception, and vestibular. OTs play a major role in orthopedics and treatment of physical dysfunction. OTs address injuries of the musculoskeletal system, including joints that affect function. You see, OTs do splinting, train people for using prosthetics, fracture management, and edema management. OTs work in a variety of settings. Ergonomics is concerned with the environment and its effect on functional productivity for work. This can involve recommending equipment for proper posture at work. OTs also work in mental health settings. As OTs are concerned with physical and sensory perceptual aspects that affect performance of roles and occupations, OTs need to have a solid foundation on anatomy, physiology, and neuroanatomy courses. OTs look at the whole being. OTs pride themselves on their holistic approach to treatment. We can assist clients in attaining functional strength, balance, and independence. Hopefully, we see clients increasing their independence in whatever occupations they pursue. So you want to be an OT? You can talk to educational counselors and professors. Volunteer in OT settings you are interested in working in, like hospitals or nursing homes. Research about OT and read articles on OT over the internet. Look at OT programs that are suited for you. Take prerequisite subjects that are required for entry level into an OT program. OT programs are giving master's degrees in graduation, so it would help that an applicant gets a degree first before applying. If you are looking for a job that you can do in a variety of settings and is fulfilling, then occupational therapy is a job for you. It is one of the most sought after jobs in the US. My name is Michael Bermudez and I have been an OT for over 14 years.